Well, aloha and good morning. Thank you so much for joining us here on Spotlight Hawaii. I'm Yenji Denise, joined by Ryan Kalei-Suji. Ryan, we just got off hearing from Governor David Ige on the state of the state, and we have another guest joining us this morning from the Capitol as well.
That's right. Starting a little bit late today, of course, just to make sure that we could hear what the governor had to say. And now we'd like to hear what the lieutenant governor has to say about some of the efforts that is currently happening with the state. And of course, as we continue to battle through COVID-19, Lieutenant Governor, good morning. Thanks so much for joining us here this morning. Want to start off and talk about the vaccine. We know that this is something that you've been working directly with. And, a recent report shows that Hawaii is actually near the bottom in ranking of states in terms of overall rollout and getting that vaccine out there. So we want to get your thoughts on just where we're at right now. We know that some of the numbers do take some time in terms of the amount of people that are being reported getting it. What can you tell us about the vaccine rollout right now and where we're at?
A big surge. So we're now at 106,654 shots that have been given out of 188,975, which is 56.2% of what we have in stock. The remaining about 80,000 individual shots, those are planned for people over the next 2 weeks to get their second shot. And in some cases, the new batch, which comes in this week, which is 36,250, I believe, those will be able to help us move the ball down the field. So we're really doing well now. If you look at the actual numbers as compared to other states, we're ranking our way up the chart, and we want to do it right. Sometimes just racing forward and doing something fast isn't the best approach. There's one state, for instance, in the Northeast that did give a higher percentage of their shots, but now they're going to wait 3 weeks before they can do anything else. So the key is to get people full immunity. People get 52 to 55% immunity from the first shot, and then the second shot delivers 94.5 to 95% immunity 2 weeks after that dose. So the key again is to do it right. And you're now seeing really big efforts here, for instance, on Oahu between Hawaii Pacific Health, who's doing amazing things. They did 1,831 vaccines on Saturday alone down at Pier 2. Queens opens up all gangbusters today. Kaiser the same, and then the rest across the state. So we have greater capacity if we get more vaccines from the mainland. There's no question. We can dive into that. I have some breaking news too for you about Moderna, but we're doing really well actually. And for every 100,000 individuals that we vaccinate, we're going to save somewhere between 450 and 1,200 lives rather than letting a pandemic roll over our state. So I hope people are able to see it in those terms. That's based on the mortality rates that exist for COVID. And I'm really enthusiastic now about what will happen in February and March now that we have all of this capacity to vaccinate people.
Right. So the capacity seems like it's there. It's just a matter of what we're getting from the federal government. And we're hearing now from this new administration about a lack of planning when it came to distribution. How much is that impacting our ability to get to the next tier? What do we, I know you don't find out till Thursday what we get from the federal government. And you mentioned 30,000. And I believe in the past it was closer to 50. So when do you expect us to actually get the doses that we actually need?
I think March is when we're going to get the big uptick, but it is actually improving now. We had 1 week that was 56,000, and that was a phenomenal week. Most weeks have been right where we are this week, which is 36,200 or 36,300 doses. I do have some important news, which I'm glad to share. We just heard through the grapevine that Moderna will be increasing its capacity by 30%. And that's really important because Moderna has been fundamentally valuable for nursing facilities, for a lot of our outreach, and for many of our kupuna who are just getting the shot straight away at our pods. So we're thinking that the big uptick, because the previous administration did not have a master plan, it's true, and that would have helped. Big uptick will happen when Johnson & Johnson and AstraZeneca are approved. Keep in mind that the Johnson & Johnson vaccination is just one shot, and it doesn't have to be kept at a deep freeze temperature. So that will make it much more possible to do it straight out of pharmacies, to do it like we do the regular flu vaccination. And very likely for young guys around the state, young men and women who feel comfortable getting one shot, the protection will be closer to 82, 83%, it looks like. But that's going to be sufficient to help a lot of people in a more easy fashion. So I'm anticipating we will finish the 1A and 1B category sometime right towards the end of February, which is not that far off. that will be over 200,000 people fully immune. We'll be aggressively going through the 1B and 1C categories kind of in parallel. That 1C category includes 65 to 74-year-olds plus people with chronic disease. So you're going to see it's already ramping up a lot, because just 2 weeks ago, I think we were sitting at 26,000 completed vaccines. And now we're, here at 106,654. Wait till mid-spring. It's going to be a phenomenal number.
And so on this current timeline and what we're seeing in terms of these other vaccines that will be coming out from other brands and other companies, that as they get approval, just the overall dose and what we're seeing in terms of stockpile will also increase. What is the timeline that you're projecting in terms of when people can start getting back to a normal life, and when we might be able to get the large majority of the people that want to get vaccinated in the state able to do so, and being able to sort of project and live life somewhat normally as we move forward?
Well, I am working on an overall roadmap for the state, and that roadmap is a reflection of getting through these critical stages, the 1B and the 1C categories. I'm going to build that to track with when we can open up more safely. In other words, this is just a teaser of it, but when you get through 1B, and that means you've done the 200,000 most vulnerable people in our society, that gives the mayors some additional capacity to open up, because the risk is less to our own people, to look at some of their tiered system and open up more aggressively. Plus, in my opinion, that's an opportunity to take a step back away from the safe travels rules for inter-island travel. And to get it through 1C, another large increment of our people will have been vaccinated. That's another basically 250,000 individuals. Then we are fundamentally safe for our kupuna and for our essential workforce and our healthcare workforce. That's when we really should ask ourselves, can we not open up and allow people to travel to Hawaii, provided they're immunized, without having to do any kind of pre-test? This is a state plan that will be step by step, that is borne out by science and can really get us open in the spring. The final group, stage 2, when you're talking about just like regular people, 35-year-old working a job but didn't get vaccinated early, number one, they're at very low risk from having severe disease. And 2, we know already that we'll be getting pretty widespread immunity through the kind of the tenets of herd immunity. So there's a lot to recommend this plan. It still has to be kind of finalized, which in the next 2 or 3 days, I will make sure you guys can get an idea of what's in it. But this is a stepwise way to get back to normal, so that in the midsummer, come July 4th, when most of our people have been vaccinated, we begin to put COVID completely in the rearview mirror. We will be safe. We'll have low risk of transmission. Our case counts will be utterly low. And look, there's a lot of traumatic stress disorder that's happening because of COVID. It's actually a phenomenon. We are seeing people traumatized by isolation, by the economic consequences of COVID, and by, frankly, the risk of getting sick. And so we have to put that behind us. And by summer, we will be able to.
I want to ask you about that essential worker, not the healthcare frontline folks. It's very clear if you're police, EMS, firefighter, or if you work in a healthcare setting, that's very easy. But the next tranche of essential workers, and also people with underlying medical conditions, that's such a wide array of people. And I was looking back at the governor's order, and that could cover people who work in certain types of retail. We could be talking about people in the construction industry, even media. Ryan and I are, technically essential workers. So who is making that determination as to which tranche you fit in? Is that something where you have to bring a work ID? And if you have a medical condition, as so many people do, who determines what medical conditions qualify? Is that something your primary care provider has to verify? I mean, how are you working all of that out for that next step?
Sure. So every week, sometimes more than once a week, the Vaccine Advisory Committee recalibrates those groups. So we take almost all of the details from the federal government. The federal government had a document that's about 10 pages long, listing each and every group that they could conceive of across the country and put them into those categories. 1A, like you described, is pretty easy, healthcare workers and elderly people living in nursing homes. But then those 1B and 1C essential worker categories are difficult to stratify. We're stratifying them heavily by age so that we can err on the side of doing people who are first and foremost kupuna, and then 65 to 74 also. That group, remember, is 109,000 kupuna, 75 and older, 148,000 people 65 to 74. But all those other categories are there. The formulation is meant to be based on how we can stay open as a state, how we can decrease transmission, and how we can continuously provide protection for the most vulnerable. So those are the first considerations. And so that list just drops down one after another after another. For instance, educators, teachers are coming up next after our kupuna age 75 and older are done, so that number one, they're not exposed in the schools to young kids, and that we can open up the schools, which helps parents across the state. And we go step by step by step. But you're right. All of these categories want to be taken care of. We get a lot of calls from people saying, am I in 1B or 1C? I get it. I totally get it. The good news is, number one, we can move in parallel as we get extra vaccine. Very important. And two, we've always expected that it wasn't going to just be the two vaccinations, Moderna and Pfizer, that it's going to be also the third, fourth, and probably a fifth vaccine, which doubles our capacity so that we can then lay in really hard into 1B and 1C. I know that people are eager to do it. And if we were ticking away at just 25,000, it would drive everybody crazy per week. But now that we're going to do double or even more than that, we'll get through these numbers real fast. As far as chronic disease goes, we will trust people. We're going to have some trust between ourselves. Most people are very honorable about this kind of thing. And if they have no health conditions whatsoever, are not going to lie and say that they have asthma or that they have diabetes, because they know in their hearts that they could be taking the vaccine from someone else who's very vulnerable. So I ask people, and I have a particular affection just to be with people and for people, because they've been so honest with me over the years, that they will adhere to that. But we're not going to force people to bring their medical records in, and we're not going to force people to prove that they're a firefighter. We know that the firefighters will step up, and we know that people who are very vulnerable can quickly, honorably get their vaccine.
It's been a few months now since the vaccine has begun rolling out. And like COVID-19, the virus itself, we're learning about the vaccine as well, and these new different vaccines that are coming out from organizations. Have you heard of anything on a state level or national level of anyone who has gotten the vaccine but had gotten COVID and maybe the vaccine didn't work for them? Do we have any sort of percentage or an idea of the vaccine in terms of if I've gotten it, the percentage of the people that have not gotten COVID-19 or those who have maybe taken the vaccine but have actually still contracted the virus?
We've really had very little data. It's a great question. It's hard to believe this, but we only got our first vaccine into the States and anywhere in the country 40 days ago. 40 days ago. That's it. So for us to assess people that got the vaccine, whether or not they had immunity and still caught COVID, very difficult. So I have not heard any statistics. There's no doubt that it can happen, because obviously, since you only get 52 to 55% immunity from your first shot, some 45 to 48% of the people will not yet be immune, and they could catch it. But it's going to be a very small number, because the percent chance of catching the disease anyway is still low, even though there's been a surge on the mainland. I've not heard of any cases at all in Hawaii yet. More of the focus from the science has been on things like, does the vaccine have what's called sterilization immunity? In other words, you get the vaccine, have you sterilized your upper respiratory mucous membranes, your nose and your throat, so that you don't carry any more of the virus particles? We're finding that to be true so far, and we're going to continue to check the data to make sure that's the case, because that will tell us it's okay to travel if you've been vaccinated. It's okay to open up businesses if you've been vaccinated, that you can't spread the disease. We're doing that work. We're checking on side effects, of course. We found very low rates of anaphylaxis. That's a severe allergic reaction. I believe the number was 21 out of 1.89 million people had an anaphylactic response, and all of them lived, thank goodness. So that's always scary when someone gets a vaccine and has a bad reaction, but we have not seen much of that. We've seen plenty of people get red arms and sore arms and have to deal with that. We've seen plenty of people have some muscle aches and joint aches. We knew that was coming, but it's been pretty benign, this inoculation. And so that's helped, because we knew that going in, about 59, 60% of the people were willing to get it no matter what, but another 20% were on the fence. And we're seeing that number go up, that people are willing to actually get it now that they've heard stories that it's basically fine, no big deal. time will tell, and the truth will come out as to how many people are ultimately willing to get vaccinated. But it'll probably be 6 months before we're able to assess whether or not there's been a kind of falling off the cliff number of cases. I'm personally seeing lower average rates, and our hospital numbers have been dropping. I can't imagine that it's already a reflection of the 106,000 or so shots that we've given. I think it's more likely a reflection that we came off the holiday numbers and our average numbers are falling. We're now at 1,656 active cases. That was as high as 2,200 about a week ago. So the numbers are really starting to ratchet down. Remember, we had that period that was 323 one day, and then 250, and then 230. I mean, we had a really bad week after the New Year's holiday. Since then, it's been much better. And so I think it's a combination of things that's coming together. Long way of saying the data takes time, but we're already seemingly seeing a better landscape for COVID in Hawaii.
Let's talk about the neighbor islands. We have this one from Glenn who says, never mind the huge vaccination clinics on Oahu. We need more vaccines for the neighbor islands, especially Maui. My mom, who's 83 years old, had her vaccination appointment canceled because of a lack of vaccines. What kind of, there's not going to necessarily be a pod, on Maui, but what kind of mass vaccinations are planned? Centers are planned for the neighbor islands, especially Maui and then Hawaii Island, where you just have, people who have to drive long distances. Are you thinking mobile clinics or what are we doing to reach people there?
Well, great question. And I definitely am sympathetic to that gentleman. It turns out we do have large pods. The pods are not the problem. We have 42 plus pods all over the place now. Maui has several. They have the big one that the county runs with Dr. Pang. They also have the large pod that's being run at Maui Memorial, and they're going to have one at Kihei that I was working with the team to set up. The pods aren't the problem. It's the national doses of vaccine that comes to Hawaii. And I did check into that because Maui had a very great first 2 weeks and got all of their shots out, but that left them short on additional shots. And so it created an expectation, which I did look at because I was afraid that Maui or Big Island might get fewer shots than they deserved, because we always have worried about that as neighbor island communities. Turns out that it was definitely proportional to the population. And I double checked and triple checked. In essence, Maui did such a good job getting those first shots out and demonstrating that it could be done, that it set a standard where people want just more. And that's the right expectation to fight for and to hope for, because we want to get a lot more vaccine to people. I'd like to get triple the vaccine to people that we are right now, but it's completely dependent on what we can get from the federal government. What happens is every Thursday at 1 p.m., they tell us how much we are allowed to order, and then we order all of it. Every last dose that we're allowed to order, we order. And then it arrives usually either late Monday or early Tuesday, and then we go and get everyone vaccinated that we can and that we have gotten scheduled. Maui doesn't want to schedule people for an additional starting shot if they don't feel comfortable that they can get that second shot also to the individuals. And so that's a part of the process. I absolutely think that 83-year-old that was mentioned should be vaccinated, and vaccinated as soon as humanly possible. I do think that all of our kupuna 75 plus will be offered a vaccine well before the end of February, and even sooner as we continuously get restocked. I'm told Maui's going to be starting up in the first week of February again as they build up some extra capacity. And if we did see at any point extra trays available on Oahu that weren't being used, we would ask to put them out into the community that's ready to go. There are shots that are needed everywhere, though, and pretty much equally. I'm really going to keep my eye on that because I understand how sensitive people are about this.
Ruth Smith also asking a question specifically about, are we able to schedule vaccines now? I'm trying to get a schedule for my 95-year-old neighbor. So what advice would you give to those out there who have or caregivers or who are in that category? What is the best way for them at this point in time to schedule their appointment to get their vaccine?
Great question. The best thing to do, and you can schedule right now, there are spaces available, although they get filled up somewhat quickly. Go to hawaiicovid19.com, hawaiicovid19.com, and it's got a bunch of links to the clearinghouse for all the places. You can also, when you call these links, there's phone numbers there. They will help you out to get signed up if someone is elderly and prefers that method, be on the phone rather than on the internet. But it's good if you can help your neighbor like that nice person is doing. We do anticipate every single week getting no less than 35,000, and I think that that's going to go up to 50,000 and then even higher when we get the next approved vaccine. So it's going to be a lot easier each week that goes by, And then I have to tell you, it's going to open up wide when we get to the spring, because when the spring comes and Johnson & Johnson is available, that's when it looks a lot more like getting the flu shot we expect, where you go to a pharmacy and the pharmacies will probably have signs on their door saying vaccine available today. And so there's a lot of change that will come, but for the immediate future, going through the 1B and then the 1C category, you still should go to that website, hawaiicovid19.com, and sign up. I know that with the addition of the Queen's Pod and, of course, last week, the Hawaii Pacific Health Pod, you're probably looking at 4,000 plus vaccines every single day. And that adds up like wildfire over the course of a 2-week process. So please, everyone, be optimistic. It is happening. And the immunity is beginning to surround you slowly, which is a good thing. Still be safe, still wear masks, still socially distance, but we're increasing our immunity with leaps and bounds each week now.
We're getting quite a few questions about, something that there was an article, I believe it was in the New York Times over the weekend, about vaccine tourism. And Hawaii was mentioned in there and briefly as one of the states in passing that people may be coming to get a vaccine. Raquel Aki says, please address tourists getting vaccinated. We are still waiting for appointments for our elders. Is there any merit to that? Do you have to show a state ID? How do we ensure that our residents, not that, of course, everyone in this country is entitled to a vaccine, but there are a lot of comments here today asking, why tourists are getting vaccines. Is that actually the case? And what is being done around that issue?
There might have been a couple one-offs, but we don't support that at all. I talked to the director of health directly about this. If people live here 6 months or more of the year, okay, absolutely. Even if they have to spend a few months on the mainland, if you're 6 months or more, you're a full-time resident, bust out your ID, we'll vaccinate you. But very few people. We're talking about a couple small incidents of that happening. And in truth, some of our people who are on the mainland for months at a time are getting vaccinations in California or Texas or Pennsylvania or New York. I mean, it's happening because it is a national initiative, but we do have a shortage. And I take to heart what Ms. Aki said, which is we should not use any of our extra resource until we've taken care of our kupuna. And that means, I think, not just 75 and older, but 65 and older. We need to accumulate this immunity because we're actually anticipating more travelers here in the spring and summer. And so I want to get everyone protected with the vaccine that can be long in advance of that. That will keep us safe as the regular world returns, as life starts to come back to normal and we start seeing travelers here again. We've done a good job with the Safe Travels program. We have not seen a surge in cases. We've kept our numbers very low, but this is just when we've averaged about 10 to 11,000 travelers a day. Historically, we had a much higher number, 30,000 or so. Now, we're not going back there, maybe ever. I don't know. Certainly not going back there for a long time. But during the pandemic, I want to get all of our people safe. And that will include hotel workers, restaurant workers, people at supermarkets that are going to see some of these tourists. I want to get all of our people vaccinated before people start looking at Hawaii as the safest place in the country, which it is. Based on our numbers, they're so much lower than every other state. Ultimately, there's going to be an inclination to travel to Hawaii. I'm also going to hopefully insist that people have their vaccine or have gotten the test before they come here. Both of those two safety measures would be very good for us.
We've heard obviously a lot of talk about the vaccine, and this is maybe a question more for your doctor hat that I'm asking right now. But what is the progress? What progress has been made on any sort of medical cure or medication that can help to treat those who have been affected? Has there been any success in terms of the medication that is being administered to those who have COVID-19 that is allowing them to have better results and to survive? Is there anything that you can speak to on that end? Because we do know there's been a lot of talk about the vaccines, but haven't heard a lot about the advancements being made on the medical front in terms of the treatment that people are receiving if they do in fact test positive and get COVID-19.
Yes, the answer is yes. The survival rates are better now, not only because we've kept our numbers down relatively in the hospital so we can attend to patients, but the monoclonal antibodies have been very helpful. To give people antibody therapy helps, and we now have that in our state and all the other states. And also to have the actual plasma that we've discussed on multiple occasions, the plasma from individuals like me who have had COVID and donated it, that also is a very good treatment. So that's helped. That's changed things dramatically for people. In fact, it's decreased the hospitalization rate because in some cases, people can get antibody therapy before they are sick enough to go into the hospital. That's one of the current uses of it. We also, of course, have been using things like we've talked about before, oxygen, steroids, and the like. Definitely the antivirals, remdesivir, help too. All of these things have kept our basically our time in the hospital down and our mortalities down. It is a challenge though, because as long as you have cases, it's been about 1.2% of our people have succumbed to the disease based on the number of positives. It's probably a lower percentage, lower mortality rate, because there are people out there that never go get a test and they had COVID. But nationally, the number is higher. If you look at the national numbers and international numbers, it's about 2% of all individuals that tested positive for COVID died. 2.1 million people have died. 99.3 million people have caught COVID. In the US, it's about 1.6% because we have a little bit better access to care. 419,000 people have died out of 25 million. And in Hawaii, it's even lower, 342 fatalities out of 25,275 cases. So that's, again, a lower percent. So it just goes to show you that people have had lower acuity. We've had a fair number of young people catch COVID in certain parts of our society, certain subsets of our community. So fortunately, they haven't passed away. Some people think because we're an outdoor society that the case rates have been a little bit more gentle on us, but we're doing really well as compared to a lot of these other states. And the final thing I would say about that is we've never had a circumstance except for about a 4-day stretch at the end of August where I thought our hospitals were going to actually overflow with COVID. We got to 318 at one point, and we were hovering between like 280 and that peak number of 318 for about 4 or 5 days. And that was taxing our capacity to care for people. Today, we're at 77 people in the hospital. So way less. And that means that intensive care unit beds, staff, and all these medicines can be adequately devoted to our kupuna or whoever else gets sick. That keeps your mortality rate much lower because you get a lot more care.
For the seniors, there's this question has come in before, and just want to address it again. Seniors, Linda says, seniors need to have walk-in clinics or drive-by. Most are not tech savvy. What about those folks who are not connected through the internet and might not have the resources or the ability to make an appointment virtually? What are you suggesting that they do?
So there's a couple ways to do it. They can definitely get support. HMSA is supporting Hawaii Pacific Health and Queens both, and so they don't have to be an HMSA member. They can be a Kaiser member. They can be anybody. They can get support in signing up. So there's a sign-up call on the website that you can do and have somebody walk you through it. As to walk-in clinics right now, it's a little bit tricky when we don't have enough resource to just overflow. We'll be overflowing with vaccine once the 4 vaccines are all approved and we're able to do it in the pharmacies. Then yes, you'll be able to walk into a pharmacy, I would imagine, and get a shot. I don't want to see people in long lines because I don't want them to be exposed to potentially catching COVID, like Ryan brought up earlier, whether people are catching it right in the middle of getting vaccinated. But that will come in time, and that will make it a lot easier. But we really want to do our seniors, to vaccinate our seniors long before then. So I would recommend calling into that line. I think that would be prudent. If we do get extra supply, I will take it to the partners and see if there can be some hours that could be conceivably used for walk-ins. But right now, pretty much within a few hours of posting additional appointments, they do get filled up. And they're getting filled up now just with 75 plus. I know there had been some discussion about that. Some caregivers were getting vaccinated. From a public health standpoint, it's probably okay. But from the standpoint of really just doing what we desire, which is getting all of our kupuna vaccinated first, we're now instructing all of our partners to just take people based on those ages. The time will come. And if people are very eager to get vaccinated, use that line, use those hotlines, get in that way, or use your children, grandchildren, or even AARP to help sign you up.
You know, our time here is wrapping up, but I did want to ask you a question about the governor's State of the State address that just happened. It's the reason why we're also a little delayed this morning in having this conversation with you, but wanted to get your overall thoughts of what you heard from the governor and his message to the state this morning.
I think Governor Ige gave a pretty thorough accounting of the state of the state right now. It has been a very tough year, without a doubt. And the gov is very analytical in his approach to governing. So he was able to reflect on, the crisis and the scope of the crisis that we've been through. I think there do remain a lot of important questions to ask still. And I think that the aspirational state of Hawaii does still hang out over us. I think a time is coming where we're going to have a vision for where Hawaii goes after the COVID crisis has left us. And that is coming. It's something that I'll certainly be offering, as will others. Right now, the gov has had to dig in very deep to this crisis. And I think he did a good job on spelling out what we've been through and what the immediate concerns are going to be.
Okay, well, thank you so much for starting your week off with us. Any parting thoughts on the vaccine? I mean, just so many people here are just so eager to get in that line and get that shot in their arms.
Absolutely. Two and a half weeks ago, we were sitting down at 26,000 completed vaccinations. Then it was 45,000, and now 106,654. So you can see it ramping up. I hope people understand that it is a big lift to do statewide. But by the time we're together again, maybe in 2 or 3 weeks, I won't be surprised at all if we will have delivered 250,000 vaccines to people. So people should have hope. We are emphasizing to the very best of our ability our kupuna and those who protect our kupuna. And this gets us to a safe place so that all sorts of other things are possible. Opening Hawaii and setting the standard for the next 10 years. That's where we have to start looking because this has been a traumatic time.
Okay, 250,000 sounds good. We hope that by the next time that is the case. Thank you so much. Thank you again, Lieutenant Governor Josh Green.
You bet.
Aloha, thank you. Well, there we heard from the Lieutenant Governor giving us an update on the vaccine rollout, saying that the state is making progress. You kind of heard him in those parting thoughts, giving us a play-by-play of where the state started and where they're going now. He is very optimistic about getting more people vaccinated as the access to those vaccines become available, as these other companies that are producing the vaccine, once those get the green light, he does expect for there to be more opportunities, of course, to other members of our community. But right now he's saying that we should see and continue to see a uptick in the amount of vaccines being rolled out into the community.
Right. And we know so many of you are so eager to get it. There were quite a few questions about tourists getting it. He said that that was a few isolated incidents, and they have been instructed to really try to limit for now the vaccines to residents. He also mentioned that there were some people who were going with a caregiver, a caregiver accompanying someone over 75 and them getting the shot as well. They're trying to put a stop to that so they can really prioritize people in that first 1A category. And he did say that he hopes that there'll be 250,000 by the next time we talk, which I believe is in 2 weeks. So we will revisit that. We also saw a number of questions about unemployment. That is not necessarily in his purview, but Ryan, we have invited Ann Pereiro-Eustachio to come on again.
Yeah, she'll be joining us in February to give us an update on where the state is at with that. We know that the last time that we spoke to her a few weeks back, that they were still working on putting together the framework that would allow for this second wave of payments, and that they were very hesitant to put any more pressure on the mainframe, which was already in a fragile state. She did express concerns that by putting more pressure on that, we could ultimately lose everything, and everything would have to go into personal and be done by hand, as she said, and case by case. And so they are taking extra precautions to make sure that the system does not fail them. And that has caused some delays. We will be talking to the governor about this issue. He will be joining the conversation later this week as well, so we can continue to have that discussion with him, as well as hear his thoughts and his further plans for what he outlined today in his State of the State.
Yeah, he talked about Hawaii 2.0. And then, Raina, to your question, can you please interview our new mayor? Crickets from that guy. Well, guess what? We have him on Friday. So, Raina, be sure to tune in for that. That'll be Friday at 10:30. As Ryan did mention, we do have the governor to talk about his vision, Hawaii 2.0, if you will, that he laid out in the State of the State, and address some of the broader questions about where we're moving as a state. And of course, we want to get into it on the budget.
Yeah, we should hear more from the governor as well later today, as he holds a press conference to discuss more about some of those plans that he outlined. Of course, the State of the State, usually a way for the governor to lay the foundation and the roadmap for the state going out through the year and giving context into where the state is at this point in time. However, there are some who are saying that there was not enough specifics about what was happening, but others are saying that he did a good job, like the lieutenant governor did, recapping what the state has just gone through with COVID-19. And so we will continue to get more information from the governor about some of those plans. We'll ask him about some of those issues, including education. We know that there are a lot of questions still here today about getting our kids back to school and what that's going to look like, as well as, of course, the unemployment questions that many of you have. All of that we'll be asking the governor on Wednesday.
So until then, we wish you a fond aloha. Please stay safe, distance, wear a mask, and take care of each other. Aloha.
Aloha.